Hey y'all, I actually have a small haul, Dollar Tree haul that I was going to film, and also I've got some medical stuff coming up in a few days that I was going to vlog about, but I just read this article concerning the Cherokee Nation. I'm a member of the Cherokee Nation as well as my kids, and it's pretty scary. But anyway, it's from the Phoenix, which is the Cherokee Nation's newspaper, and they are out of Tahlequah, Oklahoma. And it says, the headline says, nurse who potentially exposed 186 patients no longer at Hastings Hospital. Hastings is the Cherokee Nation's primary hospital in Tahlequah, Oklahoma. It said a registered nurse who potentially exposed 186 patients to HIV and hepatitis C by administering medications incorrectly at W.W. Hastings Hospital is no longer employed with the tribe. Hastings Hospital CEO Brian Hale said. The nurse responsible for this lapse in protocol is no longer employed by Cherokee Nation, Hale said during the June 11th Health Committee meeting. To my knowledge, they're not working with the Cherokee Nation at all. She shouldn't be working in the medical field for sure. Anywho, I know they're not in Cherokee Nation Health Services, he says. The potential exposures stemmed from a registered nurse using the same piece of medical equipment on patients from January to April, Health said. The CN's Medication Diversion Prevention Program discovered the reported it to health services in late April. A health service spokeswoman said the nurse used the same vial of medication and syringes to inject more than one IV bag. That, as a frequent patient in a hospital, is terrifying to think of that happening. Absolutely terrifying. Patients were never directly in contact with any needle. In all instances, medications were administered into an IV bag or tubing. The likelihood of blood-borne pathogens traveling up the lines into an IV bag or IV tubing to cause cross-contamination from using the same syringe is extremely remote. And my printer would not print out the rest, but what it simply stated was that all of the 186 patients were tested for HIV and hepatitis C, and thus far no negative or no positive, results. However, they'll need to be retested every 3 months for a year, I believe. Like I said, my printer just cut me off, so I printed it from my phone, and just because Sarah's on it. But anyway, that is kind of terrifying, and it's kind of confusing because it sounds like she used the same syringe and bottle of medication, but that's really hard to imagine. Maybe I'm just understanding it wrong from that many months apart. Or did that until the bottle was empty and continued to use the same syringe to inject into the IVs. But still, that goes into your body, that goes into your heart. You know, it's terrifying to think that someone's using a pre-used needle, if it's been in the skin or just used on one other patient next door. Just, you know, it's clean bottle, clean syringe every time. It's just really disturbing. Anyway, I just wanted to share that because I found it very interesting. It's not often these days that you hear about that. because they're so strict. And I have, you know, I've talked to plenty of nurses caring for me just out of curiosity, you know, and they talk about how they have to, for example, with pain medication, how they have to waste it. If it's a 4 milligram, for example, bottle, and they only give a patient 1 milligram, those 3 other milligrams are wasted. They do not keep the bottle, which is a complete waste, because they could use those other 3, but because it's a used bottle, they don't keep it. They waste that medication. Wasting it means, I don't know, I guess they squirt it out, and I don't know. It depends if it's a narcotic or not. But anyway, that was an interesting little story. I thought maybe you guys would like to hear that. It kind of shocked me, because, you know, in this day and age, you just don't hear about, you know, there's so many, you know, people check and recheck and have somebody else check. I know when they draw here in Texarkana, which is not part of the Cherokee Nation, but just the regular hospitals, when they pull insulin, for example, they have someone else check what they pulled. So it's more than one set of eyeballs looking at, you know, to make sure that it's legitimately 2 units or 6 units or however they're doing it. They don't do that with all medications, I don't think, but the ones that can kill somebody really quickly, they do. So anyway, I just want to share that with you guys. I thought that was interesting. Like I said, that came from the Phoenix, which is the Cherokee Nation's official newspaper. You can get it online if you're interested, and it can be mailed to you, or you can get it mailed to you physically if you want to pay for it, in either English or Cherokee. And since I unfortunately do not speak or read, I can speak a little Cherokee. I can read no Cherokee, hardly at all, except for I know what a stop sign looks like and hello. That's about it. But anyway, so yeah, okay. Y'all have a great night. I may or may not do another vlog. I don't know, it depends how I feel. Anyway, talk to y'all later. Do something good for somebody. Bye, y'all.